Hey guys, today I'm going to talk about Christian Healthcare Ministries and kind of do an update video. The last time I talked about this was right after my daughter was born. Actually, it might have been right before. Point is it's been a while, and I've been promising an update video for a very long time, and I never filmed it, mostly because I wasn't quite sure what to talk about, but I finally got some points together, and I'm going to chat today about how our budget works with that and kind of what my health routine looks like with CHM. So if you don't know what CHM is, it's Christian Healthcare Ministries. It is an alternative to insurance. So it's not insurance, but it does classify as insurance under the Obamacare plan. So I don't have to pay any fees for not having insurance because it does count towards that. How it differs from insurance, though, is that we just pay a monthly amount into the health sharing. And what happens is if I broke my leg, for example, and I had to take an ambulance to the hospital, get an x-ray, get my leg all fixed up, and then have some follow-up appointments, that all counts as one incident. And so I have to pay for that either out of pocket or set up some sort of payment plan with the hospital in order to leave the hospital. I can't just not pay a bill. And basically CHM, I'll send them all the paperwork explaining the incident, what happened, send them all the bills, so that way they have a copy of it, and they will cover those expenses at past $500. So I'm on the gold plan. There are multiple tiers to it. The gold plan, basically you pay the first $500 for a medical incident, and then everything after that, up to $100,000, is covered. So if you had something happen where you had cancer and it was an ongoing thing, it ends up being more than $100,000. There are other options, which I'll talk about in just a moment, but it covers from basically $500 to $100,000. So this is what I used to pay for my daughter's labor and delivery, to pay for my entire pregnancy, and out of pocket I ended up paying $0 other than my monthly fee, which at the time I believe was $135. I might be wrong about that. I'll double check. But basically how it works is that you are almost reimbursed for those expenses. The people at CHM will evaluate your paperwork, make sure that it falls under the guidelines for what they cover, that being a non-pre-existing condition or something that's outside their guidelines. Like if you got in a DUI car crash and you were drinking and driving, they wouldn't cover those medical expenses because you're not following the rules set out by CHM. CHM also has some guidelines for who can join. So I'm going to read this directly from their website. In order to be a member of CHM, you have to abstain from tobacco, any smoking device or substitutionary smoking device, including but not limited to cigarettes, cigars, pipes, herbal cigarettes, e-cigarettes, vape pens, etc., and also abstain from the illegal use of drugs. This pulls from the verse 1 Corinthians 6:19 through 20. All of these are following biblical principles. It's Christian Healthcare Ministries. The idea is that you're following Christian biblical principles set out, and that if you agree to follow those guidelines, then you can be a member of CHM. The second thing is following biblical principles regarding the use of alcohol, meaning not getting completely blackout drunk and then driving a car and causing accidents, for example. It doesn't mean that you can't drink, but it means to do so, have a glass of wine with dinner or have a couple beers at a brewery with your friends, but that's kind of it, being responsible with it. Attend group worship regularly as health permits. This just means you're going to church or listening to church online if you need to, or being in some kind of Bible study group. And then having a U.S. mailing address or consistent, reliable, secure internet service through which you can receive documents with confidential information. Basically, if you are a missionary or you're in the military, you just need to be able to pay your bill online and then also submit medical stuff online. So they want to make sure that you qualify. But that's it. There are other guidelines for single moms who get pregnant, things like that. So if you're interested, I will link to all their guidelines in the description box. But the idea here is that it's Christians coming together and sharing our medical costs. So I pay in monthly for both me and my daughter. My husband has insurance through the VA, so he doesn't use it right now, but he probably will eventually. And the money that we give monthly is used to help cover other people's medical expenses. And the idea is that everyone's putting into this pot, and that there's more people who are giving than taking, and so everything balances out and all your bills get covered. Now, obviously, this is a small scale thing. There's a lot of members to it, obviously, otherwise it wouldn't work. But people who are on it aren't just sick constantly. That's why it works. And they actually did raise their prices, or they're raising the prices, I believe in April or May, just a tiny bit. I've been on Christian healthcare for, I think, about 2 years now, and I have had nothing but wonderful experiences with them. The whole thing with all of my pregnancy bills was so smooth. I'll link to that video down below as well. But like I said, we paid $0 out of pocket. The reason for that is that as you are paying for your medical bills, if you get any kind of discounts on your bills, those discounts first apply to your minimum payment. It's kind of like a deductible. And then it goes towards the rest of the bills. So I ended up paying almost $20,000 for all my pregnancy expenses. But it would have been almost $40,000. But because I was considered self-pay, I got 50% off on all of my ultrasounds. I got reduced prices at labor and delivery for that. Also, because I paid things up front, I got a 30% discount over the phone when I called and paid my bills within, I think it was 10 business days of me getting the bill. So all of those savings ended up being half of the bill of what it would have been. And so because I got over $500 in savings, those savings first applied to me and then to the rest of my bill. So I ended up not having to pay that $500 minimum. Everything was just covered. So even though I had to have the money up front to pay some of those bills on time or early in order to get those discounts, being able to just have that cash flow, I got all the money back. So it was nothing out of my pocket, which it brings me to our budget. So currently, every month, we are paying $235 to CHM. That's for the gold plan for myself, and then the next level tier down for my daughter. In May is when the price goes up, so we'll pay $290 at that point for me and my daughter to be covered. The reason my daughter isn't on a gold plan, by the way, is because right now her medical expenses are so low because, we're just doing shots and stuff, where me, if I accidentally got pregnant again or something, the gold plan is the plan that covers pregnancy. So we want to keep me on the gold plan because you have to be already on the gold plan before you get pregnant. So if I suddenly found out I was pregnant, I have to be on the gold plan to have that covered, which is why I'm on it and she's not. So that brings me to the other medical stuff, because if it's under $500 for a medical treatment of any kind, then you have to pay for that yourself. CHM doesn't share that cost, and that's how they're able to do this whole program. So, for example, we took my daughter in for her 1-year appointment and her 1-year-old shots. That ended up being about $300 total. We go to a doctor kind of far from us because they're a little bit cheaper, and so that doctor charged around $220, and that was just out of pocket. So we know at least once a year we have to take her into the doctor for her physicals, so we just budget for that throughout the year. And so normally what we do is we heavily overestimate what the cost will be. That way, anytime that she's sick and maybe we have to bring her in for something for the flu, maybe she has a fever, maybe something's wrong, she breaks out in a rash and we have to take her in. Basically what we do is we plan out to spend around $500 per year on her medical expenses. So $500 divided by 12, we save about $42 a year for her medical expenses. So basically for her shots, what we do is if we did her shots, like her immunizations, her flu shot, all that stuff, through her normal doctor's office, they would be very expensive. I'm talking $500 or $600. So we can't afford that right now. While we're paying off debt, that's just not an option. So what we are doing instead is we go to the community health center, which is a public service, and they have shots available for people with low income or people without insurance. And since we qualify under that, then we go and get her shots done there. And they, I think, are $22 per immunization. And that is a recommended amount. You don't have to pay anything. So if you truly do not have the money, you don't pay anything. Obviously, me and my husband are able to pay that amount because total, you know, if she needs 4 shots, it's like $100. We can pay for that once a year. We can't pay $500 per shot. That's insane. So that's kind of what we do. So every year or so, it costs between $300 and $400 just for her normal physicals, normal shots, all that good stuff. And then for me, it's about the same. I'm not getting immunizations, obviously. I'm already done with all of those. So I have my yearly physical, and then I have all of my checks that every woman gets every 3-ish years, and mine's coming up this year, so we put aside some extra money, and we have about $500 or $600 for me every year as well, so that way, if I get sick and I need to go to the doctor for whatever reason, to get medicine or whatever, that's what I do. The other expense that I think a lot of people don't consider is like birth control. CHM does not cover any kind of birth control. You are allowed to take it under CHM. They have no problem with you taking it, but they don't cover it. After my daughter was born, I did get on birth control pills right away. I had to do the low hormone, it's called the mini pill, because I was still breastfeeding. So I did have to pay for those out of pocket. Those are about $90 for 3 months. So $30 every month is what we budgeted for that. I ended up finding out that Sam's Club actually has prescriptions, or has that specific prescription for, how much was it? I think it was $24. Is that right? It was right around there. It was a third of the price, essentially. So it ended up being about $10 a month, which has been great. That is kind of how we are currently budgeting for all of our medical expenses. So $10 a month for the birth control. We're saving, even though I said $42 is what it breaks out for my daughter, we're actually saving $50 a month for her. And then we are saving $25 a month for me because I don't need immunizations and all that stuff, other than the flu shot. But that's $85 a month that we are solely just putting into a savings account so that we have those medical expenses covered if that comes up. And then I'm going to go off their new pricing, so add that to $290, and that is $375 a month to have both me and my daughter covered and basically have insurance for us too. Now that still is a lot of money. $375 is pretty high. It's a big expense, but when you compare that to how much I would have been paying if I had kept my original insurance and had to add my daughter to it, I'm still saving $200 to $500 per month. And not only that, but I'm not paying anything out of pocket. I'm not paying for deductibles every time we go to the doctor's office. A lot of times I get discounts that I wouldn't get if I wasn't self-pay. And to be honest, because we don't have any prescriptions or like ongoing health concerns and we're fairly healthy, there's no reason for us to have traditional insurance because we don't have anything that needs to be covered extensively. Now, obviously, CHM is not for everyone. First of all, if you're not a Christian and you don't want to follow those guidelines, obviously this isn't built for you. There are other health sharing ministries that aren't Christian-based, but a lot of them are, just because it's based on a biblical principle of taking care of your community. But there are other options as well. And obviously, if you have really good insurance through work or something, if you pay less than $200 for your insurance right now and it's a good insurance, it's covering your basic needs, switching won't change really anything. What CHM is wonderful for is for families bigger than 3 people, because once you have 3 members, adding additional members doesn't add additional costs. So your cost is set, which is wonderful. And if you are thinking about becoming pregnant in the next year or so, it's really worth looking into because it can save you so much money on your pregnancy expenses. There are certain things that it doesn't cover, like a doula, breast pumps, things like that. But with the amount of money that you're saving by not paying deductibles and higher health insurance costs and things like that, you can probably pay for all that out of pocket without any issue. All right, you guys, that is it for this video. Let me know in the comments if you have any questions about CHM. I'm going to link to all the resources, including the whole blog post I wrote about CHM extensively but I really, really recommend you check it out. I have loved using them, and I probably will continue to use them for as long as I can. So that's it for you now, and I'll see you guys next time.